Can immunosuppression after liver transplant cause cancer? Can immunosuppression after liver transplant lead to cancer? Yes, it can. When a person receives a liver transplant, they must take immunosuppressive medications. These drugs are crucial for preventing the body from rejecting the new liver. However, they also lower the immune system's ability to detect and fight off cancer cells. This means that liver transplant recipients may have a higher risk of developing certain types of cancer. Research shows that patients who have undergone a liver transplant have a 2 to 4-fold increased risk of cancer compared to the general population. The types of cancer most commonly seen include skin cancers, post-transplant lymphoproliferative disorders, which are a type of lymphoma, and other solid tumors. Younger transplant recipients tend to have an even higher risk. The longer a patient is on immunosuppressive drugs like tacrolimus, the greater their risk becomes, especially within the first year after the transplant. The reason behind this increased risk lies in the concept of immune surveillance. Normally, the immune system helps to identify and eliminate abnormal cells, including those that could lead to cancer. When immunosuppressive drugs are used, this surveillance is diminished. Additionally, some of these medications might have direct effects that could promote cancer growth or change how cells behave. Managing this risk is a delicate balance for healthcare providers. They need to ensure that the dose of immunosuppressants is enough to prevent rejection of the liver while also trying to minimize the risk of cancer. In some cases, doctors may consider reducing or withdrawing immunosuppressive therapy, but this must be done carefully and is not always straightforward. For liver transplant recipients, ongoing cancer screening is essential. This includes regular skin checks and monitoring for lymphoproliferative diseases and other cancers. If a patient had liver cancer before the transplant, this can also affect their risk of developing cancer afterward and may influence how their treatment is managed. In summary, while immunosuppression after a liver transplant is necessary for the success of the procedure, it does come with an increased risk of cancer. This highlights the importance of regular follow-ups and screenings to catch any potential issues early. Always consult with healthcare professionals for personalized advice and management strategies.